Welcome to Focus on Your Health, your radio home for news and stories from Kingman Regional Medical Center, here on the KJazz Radio Network. I'm TG LaFredo, and this week I'm speaking with Dr. Geoffrey Cornelsen, an orthopedic surgeon and a new guy in town. Hi, Dr. Cornelsen. I'm glad to have you here.
Good to be here.
You are here in your brand new office in the Medical Professional Building. It's very reverberant.
Yes, it is.
They went all out on the interior design for you.
Yes, I have one generic picture and a calendar. So
one calendar that. So, do you have some plans for the place, or are you going to go with the Spartan design here?
No, I have a few plans. Diplomas and whatnot to put on the wall. That always looks nice. But some pictures of the wife and kids too. So
books. You've read some books, I'll bet.
Certainly, I have more books than can fit on the bookshelf. We'd have to bring in a second if I wanted to bring all those in.
What it means is I asked you at the right time for an interview because your schedule is not super packed right now. And I can tell that. That's my diagnosis just by the look of the office. You just started a week ago, right?
I did. Things are picking up well. I've met a lot of great people and started or will be starting with surgeries in just a couple of days. So, things are picking up quickly.
Okay, so let's take a step back. Who are you? Where are you from? Shoot.
All right. I grew up in southeastern Idaho and did my undergrad education at Idaho State University. I then worked for a few years and went to Des Moines University for my medical education. I spent 5 years in Pennsylvania doing an orthopedic surgery residency and signed on for one additional year in Minneapolis to do a sports medicine fellowship.
Were you one of those kids, did you know early on that you wanted to be a doctor?
That's kind of a funny question. When I was in 8th grade, our teacher had us write a letter to ourselves, and then they were going to send it to us in 10 years.
I love this assignment, by the way.
It was incredible.
At 8th grade, you are, about 13 or 14 or something like that? 14. Okay, go ahead.
Yep. So when I was 14, I wrote this letter to myself, and it said embarrassing things about the girl I liked at the time. But the most important bit was that it said that I wanted to be a surgeon.
Wow.
And I received that letter just a few years ago. He ended up saying that some of them got lost and it was more than 10 years before he sent them out. But I received that letter when I was at the point of being through with medical school. I was a physician at the time and partway through my orthopedic surgical training. And that was so neat to see that and to look back and, here we are 20 something years later and it's finally come true.
Did you have any memory of that assignment?
I had completely forgotten about it until it arrived, and I opened it and I started reading it, and then I remembered, and it was this incredible thing, and that's a very neat thing for me now to have that.
So you knew early on you wanted to be a surgeon. What in particular led you into orthopedics and your interest into sports medicine?
Well, I've always been interested in sports, but it wasn't until much later that I came to that decision. I wanted to be a surgeon because I liked medicine and thought anatomy and physiology was fascinating. In fact, I ended up spending more time studying for that in high school than anything else just because I truly loved it. But I've always done a lot of things with my hands and really enjoyed that. And that is what led me to combine the medicine with surgery is so that I could be in there involved in doing things with my hands. Right. I myself had a knee injury while skiing and ended up visiting the orthopedic surgeon and had a meniscus tear and going in and having that treated. And that really started me onto orthopedics. And it has been a process, but that was really the thing that pushed me down the path. The other thing that I would say that I really like about orthopedics is in medicine, we do a lot of things to lengthen the quantity of people's lives. And some of that is fantastic, but oftentimes we lengthen the quantity but not the quality. And in orthopedics, I don't do a lot of things to lengthen the quantity of people's lives, but I sure do a lot to improve the quality of their lives. If I can do something that helps grandma or grandpa get down and play with their grandkids, or somebody get back out there and get back out on the softball field or the basketball court or the football field. That's what I want to do. There are so many people who are out there who love running, but something sidelines them. And if we can solve that issue and get them back out there, they can do the things that they want to do. They can maintain their health, and that will carry over for a long time in the future. And that may mean athletes that are in junior high or high school or at the college level, or as I like to refer to people, mature athletes, which is where I now am, is those of us who don't want to stop being athletes, but we may not be involved in organized or high school or collegiate level sports, but I still do a lot of races or different things, and those kind of things can lead to injuries too. So we just want to make sure we get people back out there doing the kind of things that they want to do.
Yeah, and imagine some of what you do, as you say, helping a grandma to get down and play with the kids, and some of it is probably occupational, helping somebody get back to work, but play. I'm not going to be a professional athlete when I grow up. I think it's a little late for that. But boy, we really need to emphasize the importance of play, and not just for fitness reasons, I think, but also for psychological reasons.
Absolutely. That's so important to us, to do the things that we want to do the things that we love. Those are the things that keep us going and make us look forward to waking up the next day, whether it be for that we're doing it to stay healthy or doing it just because we love doing it. We can get you back there.
I have a note here that says that you are an avid rock climber, runner, and golfer. True?
I would say I'm an avid runner.
Okay.
I used to be an avid rock climber. I love that and am excited to be back in an area where I can do that more.
Right.
Having lived in Iowa and Pennsylvania and Minnesota, there are not as many opportunities, so that is suffered. But I'm looking forward to doing more rock climbing because I truly love to rock climb. Golfing also, I love to golf. I look at it that I get more strokes for my money than other people do because I am not great yet, but looking to improve on my game. But I definitely love running and enjoy rock climbing and golf.
You mentioned that you had a knee injury while skiing. So 2 questions. One, do you ski anymore?
Yes.
Okay.
Not as much as I did before, and I try to be just a little more careful than I did before. I don't do quite as many dumb things as I used to.
They did tell you we don't do a whole lot of skiing in Arizona, right?
Yes, I realize that Flagstaff is a couple hours away, so if we want to go, we can. But I'm fine doing less skiing. Okay.
And my second question about that is, did that surgery restore your functionality? Do you ever have moments where you're like, ooh, that's my trick knee?
The surgery restored, it's hard to give it a percent, but probably 98% of my function to my knee. Most of the time I don't feel it at all. The times when I do feel it are if I overdo it just a little bit, it might ache slightly compared to the other side, or when I'm skiing, is really, you get it down in a position where it bothers me a little bit more. Right. But really, other than when I'm skiing, it's hardly ever that I notice that knee.
No problem while you're running?
No problem while I run.
Are you a marathoner?
I have not done any marathons yet. I have done a number of half marathon length races, and looking forward to expanding that horizon.
Are you going to make the jump?
I am.
Yeah.
I am. The question is when. I think probably within the next year, but that's to be determined.
I've run a few. There are some really nice ones out west. And as you know by now, you've only been here briefly, but as you figured out, the summers are pretty hot. So I've run some in the summer, and a couple of them are real killers. But I think a nice way. You didn't ask for advice. I'm just dispensing it. I do that. Hand me a microphone and I start dispensing advice. But spring and, like late fall, winter, those are ideal times to run because it's still here in the daytime. We might be 65, 72 degrees.
Perfect. That's ideal running conditions.
It's not Minnesota.
No, we're looking forward to the warm weather. We've enjoyed having a pool and spending time out outdoors. But definitely going from Minnesota to Arizona in August was a bit of a change, and it's going to take me a year to acclimatize, I think.
Yeah. Before we started the show, I was telling you that I'm from Buffalo. And when I was up there and dreaming of the Southwest, and I mean, I loved to run then too. And I had this idea of definitely this romanticized notion about the West and about my life out here, what it would be. But that part of it is exactly right. I run every day or almost every day, long open roads, flitting birds, sunlight. I don't put on, I don't want to say I don't put on pants all year. That's how to say that. That sounds scandalous. I run in shorts all winter, and it's just fine. It's awesome.
That's wonderful.
Yeah.
I'm looking forward
to
that.
So welcome. Yeah.
Looking forward to that. Looking forward to getting off of the treadmill for all winter long, because in Minnesota, it's literally dangerous to run outside in the wintertime. And so if you want to continue to run, you've got to find a treadmill. So it's nice to be able to get outside.
All right. So here's a question for you. You have these two strong interests, sports and medicine, and knowing what you do about the human body and the way it works. How does that inform your training and your participation?
Well, it influences a lot of things. I think that one thing that it really does is it influences me to cross-train. Anytime the body is subjected to the same thing over and over and over again, it does two things. One, it becomes accustomed to it, and so you will get less of a bang for your buck for working out. The second thing is the same repetitive trauma. While your body does get used to some of it, this trauma can build up and cause injuries over time. And by cross-training and doing different things, it exercises different muscles, and you become more fit overall, and avoid some of these overuse injuries like stress fractures, which can be common in runners. The other thing that has become popular with many teenagers and younger athletes is participating in the same sport year-round. And while that may be helpful in getting someone into college and a college scholarship, it's actually very difficult on the body. Even professional athletes have 3, 4, 5 months of an off season where they do very little in relation to their sport. They may pick up, running or doing something to keep them in shape, but they avoid doing those same types of activities because doing the same thing all year round can be harmful for the body. So I think that that's probably the first thing that I would say. And the second thing that I would say is fuel. Just like you wouldn't put leaded fuel in your car if it was designed for unleaded, or you wouldn't put poor fuel in your car, you need to put good fuel in your body. And if you are trying to make that next, the jump to the next level, you need to be thinking about the types of things that you're eating, and that really can help you to make that next step.
It's break time on Focus on Your Health. When we return, we'll talk Tommy John surgery with Dr. Geoffrey Cornelsen. This is the KJazz Radio Network. And welcome back to Focus on Your Health here on the KJazz Radio Network. This week I'm speaking with Dr. Geoffrey Cornelsen. He's an orthopedic surgeon with a subspecialty in sports medicine. I want to ask you about your training because you had some really cool assignments along the way. Tell me about your fellowship.
Well, my fellowship I spent in Minneapolis, and I worked with several different teams, and I worked with the University of Minnesota and Big Ten football, and that was a lot of fun. the way that it kind of worked is I was orthopedic surgeon by day and sports medicine physician by evening or night. So I would get up and we'd do surgery, and then as soon as we were done in either the OR or in clinic, then I would leave and go over to the university and be there for football practice or for the games. After football season, I helped with their wrestling, and if you're not familiar with University of Minnesota wrestling, they are always among the best in the nation. Okay. So that was also a lot of fun. In the spring, I worked with the Minnesota Twins, which was a lot of fun. I went down to spring training in Florida with them for a week and spent some time there, and worked with the minor league guys doing physicals and with the major league guys as well, and then helped cover the baseball games and even the All-Star game, which was in Minneapolis this year. So all of those things were really great experiences.
What is that gig like when you're there at the ballpark?
Well, it's a lot of sitting and waiting for things to happen. You see some players before the game starts, and you are monitoring anyone who's recovering from an injury. You see anybody who has issues during the game. You might see somebody who gets hit with a ball, or pulls a muscle, or has an injury sliding into a base. But for the most part, you're enjoying watching the game, and you spend some time in the training room, spend some time in the press box, and then talk with the players. Yeah, it's game time is fun time.
Yeah, wow. So I want to ask you, I was listening to a commentator recently and a baseball game, and he was saying that 2014 could sort of be considered the year of the Tommy John surgery. I think overall we've seen a rise over the last several years. What's the deal with that?
That's a good question.
Yeah.
Tommy John surgery has been around for quite some time, but
And what is it?
Well, Tommy John surgery is reconstructing the ligament on the inside of your elbow.
Okay.
It's called the medial collateral ligament, or medial ulnar collateral ligament, which is why we just call it the Tommy John ligament, because it's so much easier to say. What happens is when you were trying to throw the baseball really hard, that ligament on the inside of the elbow gets stretched, and that can injure it in one of two ways. Either over time, as just that repetitive stretch, you think of stretching a rubber band, eventually it doesn't go back quite the same. It stretches out and becomes weaker. Or if you pull too hard, that rubber band is going to break and will pop. And, players can feel a pop or a tear. And if you have a partial injury, sometimes you can recover from that with physical therapy, but complete ruptures of the ligament often require reconstruction. And now that we've been doing this surgery for quite some time, we've tried several different ways of doing it, and we've found something that works pretty well, and we've been doing it long enough that we have outcomes showing that players will fairly reliably not only recover from surgery, but can get back to playing at the level they were playing before, or occasionally higher. Major league guys who have their Tommy John ligament reconstructed can expect to miss 1 to 2 seasons. Usually they miss one season, then they come back the next season and have a year where they're slowly getting better and better, but it's the second year back where they really feel like they've got their elbow back and they've got their arm back and their mechanics are coming back into line. So it's a big commitment, but we can fairly reliably get these people back and playing for several years in the major leagues.
Does it seem like pitchers are opting for that sooner now? Is it maybe have to do with better success rates with the surgery?
Yes, I think it does.
Yeah.
When Tommy John first went to his orthopedic surgeon and said, "I want you to fix this," it was a career-ending injury. There was no surgery. They invented the surgery for him, and his surgeon said, Dr. Frank Jobe said, "I don't know if this is going to work," but they did it anyway, and he ended up with another surgery to move the nerve, but was able to come back, and most of us know the history. He came back and played phenomenally well, and here he is in Hall of Fame.
Yeah. I was listening to a game not too long ago. Tom Candiotti is the analyst for the Arizona Diamondbacks. And of course he was a knuckleballer, but he had Tommy John surgery somewhere in the early 80s. And he was saying that at that point, success rates were, 1 in 10, 2 in 10. He was really gambling with his career. But he ended up having one of the first notably successful surgeries. And so they were joking with him that it could have been called the Tom Candiotti surgery instead of the Tommy John. But he was saying a season or two later when he was coming back, he pitched against Tommy John. And before the game, they talked and kind of compared notes.
That's a really neat story. Now we don't do it exactly the same way that Dr. Job did when he first started doing the surgery. We've got some technique that has better results. And so fortunately, our odds are a little bit better than 1 or 2 in 10. Right. But there's no guarantees. And if we can get 80 or 85% of people back doing the things that they want to do, that's, again, not a guarantee, but that's pretty good for something that not very long ago was career ending.
Is this a tough procedure to do from a surgeon's perspective?
It is. There's the ulnar nerve, which comes down the inside of your arm to your hand, which lies right in the way, and you need to either move it out of the way or work around it very carefully. And when you do that, it becomes difficult to do without damaging the nerve. We can fairly reliably do that, but you just have to be technically careful.
Yeah. Okay, so we touched on Tommy John. What other sorts of procedures do you do?
Well, I do a lot of knee and shoulder surgeries. I would say those are the two most common joints. I'll do knee arthroscopy or knee scope, and that can be treating the meniscus, or occasionally there's some cartilage surgeries we can do to restore that surface cartilage. I also do shoulder surgeries, and that can be rotator cuff most commonly, or there's other things going on, bursitis or impingement, if you've heard about those sort of conditions. I also do hip and ankle arthroscopy, which is something that not a lot of people do. Sometimes you can tear the labrum in your hip, which is a cartilage bumper around the socket that helps hold the ball in the socket, and that can cause some pinching and pain. Or in the ankle, if someone has had repeated ankle sprains or a really severe ankle sprain that just is not getting better, sometimes that requires going in there with an ankle scope to debride or remove some of the scar tissue and then to repair the ligament that's torn.
You talk about knee surgery. We talked about running. It's an obsession we both share.
Yes.
There are kind of two schools of thought on running. I tell people I run, and sometimes they say, oh, it's hell on the body. It's awful. You'll destroy your hips and your knees and your ankles. And then there's this other school of thought that that human beings were born to run, and it's perfectly natural. And I want you to help me settle this.
Well, that's a tough debate, and I don't know that in the amount of time we have that I can help settle that.
Okay.
What I can say...
You can weigh in on it.
I can weigh in on it.
Okay.
So I think that running, if done with good form, is not terribly hard on the body. The surface you run on can make a difference, and if you run and you have a really hard heel strike, that can be hard on the body. But there are ways of transitioning. A lot of people for a long time talked about barefoot running or forefoot running, and now we've backed off away from that a little bit too, because we know that can cause some injuries as well. But having more of a midfoot strike will absorb more of that force and can be easier on the body. The other thing is modifying your surface. If you're running on concrete a lot, that is harder on the body. Even if just switching to asphalt, or even better, trail running, those sort of things can really decrease the impact on the body and can allow people to run and do this thing that they love to do that helps them stay in great shape and helps their whole being and their overall wellness without putting too much undue stress on the body.
That's Dr. Geoffrey Cornelsen, orthopedic surgeon at Kingman Regional Medical Center. You can reach his office at 928-681-8693. That's 681-8693. Dr. Cornelsen, thanks so much.
Thank you.
And that's the show. I'm T.G. LaFredo. Thank you for listening. Please join me again next Saturday at 11:30 a.m. for another edition of Focus on Your Health. right here on the KJazz Radio Network. Perfect. That's a show.
Well, thank you. That was much less painful than I thought it was going to be. No, and that's not even the right word. It wasn't painful.